So we conducted a national case control study in Canada to determine risk factors for NMOSD. I think NMOSD is a very intriguing disease, and we still have quite limited knowledge about the causes that lead people to develop this disease. And in the past, a lot of our knowledge of risk factors for NMOSD has arisen from retrospective case series, so uncontrolled studies. Therefore, we decided to adopt a somewhat innovative approach. We utilize the EnvIMS questionnaire, which is a questionnaire that has been used extensively to study risk factors for MS in multiple countries, and it's well validated. And we were therefore also able to utilize the unaffected controls from that study and tap into a large group of controls. But when we distributed this to people with NMOSD, one of our key findings was that non-white ethnicity, particularly East Asian ethnicity and Black ethnicity, was strongly associated with risk of NMOSD. That has been observed in other cohorts. One interesting finding we had was that age of onset of NMOSD also varied with ethnicity. Our Black participants had the youngest age of onset, followed by East Asians, and then white individuals with NMOSD had the oldest age of onset. Interestingly, though, we did have many NMOSD participants who were immigrants to Canada, but we did not find that age of onset of NMOSD varied with immigrant status, in contrast to what we have observed in MS in Canada. So that leads us to conclude that the Canadian environment, which is low in sunlight and vitamin D, and we know is a very high-risk environment for MS, probably does not drive the risk of NMOSD. Another interesting finding that we had that has been observed in other studies is that risk of NMOSD was associated with risk of comorbid autoimmune diseases. However, we didn't find any association with higher BMI or lower rates of physical activity, which has been reported in some previous studies. And I think the finding about comorbid autoimmune diseases is interesting. It begs the question whether there might be an autoimmune cascade around the time of NMOSD onset. And if that is confirmed, that could lead to further research to try to optimize early diagnosis of NMOSD and also better understanding of the etiology of the condition. A key factor in NMOSD is we know that there are circulating antibodies that then, there is an aberration in the systemic autoimmune control. And then there's a second event likely with breach of the blood-brain barrier that leads to penetration of these antibodies into the CNS. So, one question that's driving my research right now is there a way to identify these individuals somehow at an earlier stage? And perhaps we could achieve earlier diagnosis of NMOSD as a result. So we're trying to investigate, for example, whether there might be a prodrome to NMOSD.